Being here this morning with you is indeed an honor and always a pleasure. At the offset again, I'd like to welcome all delegates and participants to this symposium, and I'd also like to thank you all for taking time out and registering for this symposium this year. That actually shows your dedication towards this very worthy cause and your contributions towards the health sector. At the foremost, please allow me to congratulate the Fiji Nursing Council for the vision to invest heavily in this auspicious annual event that is aimed at progressing the development of nursing in Fiji. Any initiative to strengthen further professional development of our health workforce is greatly welcome and will be supported, as we know that the end result will be manifested in the improved standards and quality of our healthcare and health service. Ladies and gentlemen, I suppose we are all excited about how nursing has progressed its development. Again, if I may mention, yesterday we launched 6 key nursing documents. That is 3 strategic plans for nursing at Ministry of Health and Medical Services, the Fiji National Council, and the Fiji College of Nursing, and 3 scopes of practice for registered nurses, registered midwives, and registered nurse practitioners. This, ladies and gentlemen, demonstrate the great vision and growth of the profession and, of course, commitment to drive nursing to newer dimensions. So once again, congratulations. Nevertheless, at this juncture, I'd also like to acknowledge and welcome our overseas guests who have been invited to facilitate respective sessions in these 2 days. And once again, I acknowledge and welcome Chief Nurse Australia, Professor Deuba. Welcome once again. Academia of the James Cook University Australia, the directors, WHO representatives, and all our overseas guests. So welcome to Fiji, and once again, sincerely thank you for your kind support towards this year's National Nursing Scientific Symposium. Your being here has indeed added great value to our program, and I'm sure the participants, all of you, are eagerly looking forward to share your expertise that will be shared through your sessions. We trust that you will enjoy being with us for these next 2 days. So please do make the best of your trip to Fiji. For those of you who have traveled out of Suva, welcome to Suva and enjoy the Suva hospitality. I believe it's only fitting to commend all of you who have made an effort to attend this program, and I note with interest the content of the program, and I'm certain that this will be time well spent, and of course your $150 well spent for acquiring new knowledge, information sharing, and mapping innovative ways forward for nursing development in Fiji. Ladies and gentlemen, the presence of our retired colleagues is a bonus indeed, as we will encourage them and provide them the opportunity to share their valuable experiences that can assist us to shape the future of nursing. The theme, Overcoming Nursing Challenges in Achieving the Sustainable Development Goals, would not have come at a better time. The appropriateness and relevance of this topic, I believe, will generate a wealth of discussion in these 2 days with some evidence-based information and directions on how best nursing could address the challenges in achieving the SDGs. The idea of SDGs has quickly gained ground because of the growing urgency of sustainable development for the entire world. In relevance to health, SDG 3 and 6 on good health and well-being and clean water and sanitation directs some degree of responsibility for health professionals and health ministries throughout the globe. Nursing at the front line of any health service delivery system is challenged to embrace the targets of these health-related goals and work towards its achievement. The promotion of well-being and ensuring healthy lives for all ages in our population continues to be a significant priority in government's agenda, with the Ministry of Health and Medical Services as the line ministry taking responsibility. On these goals, Fiji has created significant inroads to increasing our life expectancy with strong emphasis on wellness and the aggressive control of lifestyle diseases, reducing some common killers associated with child and maternal mortality, increased access to health services, and improved and advanced intervention on communicable diseases. The increased access to health care required by our women is also noteworthy in the achievement of this goal. Meeting women's contraception or family planning needs is indeed a pivotal action area, and the major progress made on increasing access to clean water and sanitation to reduce some of our die-hard vector water and airborne diseases such as dengue fever, leptospirosis, typhoid fever, tuberculosis has been marked on our health priorities. Ladies and gentlemen, the development and formation of constructive and innovative plans to ensure availability and sustainable management of water and the improvement of sanitation by line ministry and relevant players such as the Ministry of Health will definitely impact this goal. Strategic approaches to control the spread of HIV/AIDS in Fiji is an important target, and the overarching aim to generally reduce deaths and morbidity from evitable causes impacts the achievement of this vital goal. The fifth goal on gender equality, which is a cross-cutting issue, may not have a direct involvement with the health ministry. However, the government remains adamant that providing women and girls with equal access to education, healthcare, decent work, and representation in political and economic decision-making processes is of great importance. It is attested that through Goal 5 in the Gender Equality Standalone Goal, the Sustainable Development Goals can be successful if women are completely integrated into each and every goal. It has been argued with widespread consensus that progress on any and all of the SDGs will be stalled if women's empowerment and gender equality is not prioritized. Similarly, government has also increased its involvement with climate change, and our ministry has made significant progress with its direct and indirect partners in placing climate change in its ministerial agenda. Having dwelled on SDGs, ladies and gentlemen, I believe it's very crucial to also consider and dissect the challenges that has hindered, affected or gradually slowed down the achievement of these goals from a nursing perspective, as per the theme of your scientific symposium this year. Nursing throughout the world, as mentioned earlier, plays such a pivotal role in the achievement of health-related SDGs. However, the challenges that nurses face should be addressed and appropriately dealt with. We can assume that the gravity of these challenges cannot be underestimated and should be given serious attention. Nursing shortage around the globe is an undebatable fact. While nations have continued to develop matching strategies to address these ongoing issues, building nursing numbers in every way possible will have a great impact in achieving health service needs, population health needs, including the achievement of local and global health initiatives, including SDGs. Fiji has significantly progressed in additional new nursing positions in the last 7 years, and government has continued to keep up on its agenda. Today, we have managed to increase an additional 1,300 new nursing positions. However, with the existing health landscape, nursing leadership have continued to present the need to review these numbers by 2018. Empowering nurses to administer these strategic and operational goals in achieving the SDGs should be given due priority. Appropriate tools such as capacity building mechanisms, proper monitoring and evaluation systems, development of relevant policies and guidelines, and investment on well-defined and committed resources is equally necessary. I am encouraging nurses to rise above all these challenges. Our solution to these changes may take some high-level negotiations. However, we can begin with what we have available. Attempting to make something from what we have at hand for now is no better way than remaining idle and playing a wait game. We need to start small somewhere. And I'm certain that the evidences are before us in terms of evolving population health needs, disease trends, and the impact of climate change here at home and our Pacific neighboring countries, along with our pertinent health indicators that is already reshaping our landscape for policymakers and, of course, practitioners like nurses. This will, in a way, determine our plans and actions and course of actions towards achieving SDGs. I'm positive, ladies and gentlemen, that these 2 days that you will spend here will definitely pose and create the stimulant to further discuss how best our nurses can meet and address these challenges in achieving the SDGs. Your program shows a good attempt to focus on this pertinent issue, which I believe will surely set the pace for future directions. The good blend of junior and senior participants evident at this symposium denotes a very healthy approach to covering the essence of your theme on the note. On that note. So at this point, I'm delighted to declare your 2 days National Nursing Scientific Symposium 2017 officially open, and I wish you all the best for your deliberations. Thank you very much, and God bless.